In the third section, now we will talk about the etiology. What are the causes of the inflammation of the pharynx? The most common causes will be the viral infections, and then we have some fungal infections, bacterial infections, and then there are also some miscellaneous causes of inflammation of the pharynx. So viral infections causing pharyngitis. We have herpangina. Herpangina is a viral infection that can cause pharyngitis. Infectious mononucleosis, cytomegalovirus, pharyngoconjunctival fever, acute lymphonodular pharyngitis, and then measles and chicken pox. All these are the different viral infections that can cause also inflammation of the pharynx or pharyngitis. So we have infectious mononucleosis, cytomegalovirus or CMV, pharyngoconjunctival fever, lymphonodular pharyngitis, measles and chickenpox are the common childhood infections. All these infections can cause viral pharyngitis. These are the pictures that gives the different presentations or appearances of the throat in the viral infections. So one by one, let's talk about these infections. First, the herpangina and the infectious mononucleosis type of pharyngitis. Herpangina is caused by group A Coxsackie virus. So Coxsackie virus is responsible for herpangina, and this in turn causes acute pharyngitis or inflammation of the pharynx. There is fever, sore throat. Always the pharyngitis is associated with sore throat and difficulty on swallowing, and usually with any infection, fever is also present. So in this case, herpangina, fever and sore throat is present. Then we have vesicular eruption on the soft palate. Soft palate is the front portion of the roof of the mouth. If you touch the front part with your tongue, it's soft, and then the back is hard, that's the hard palate. So soft palate, there is vesicular eruption present on the soft palate. Vesicles are small and they are surrounded by erythema. So the smaller portion, they have vesicular whitish in color, but the surrounding part of the vesicles, it's reddish or erythematous. That's the characteristic of herpangina vesicles, that they are surrounded by erythema or redness. Present on the soft palate causes fever and the sore throat. And it's caused by Coxsackie virus. Coxsackie virus is the causative agent for herpangina. Then the other condition is infectious mononucleosis. This is the condition or disease caused by the virus known as EBV or Epstein-Barr virus. Affects older children and young adults. Fever, sore throat, and there is exudative pharyngitis. Lymphadenopathy, splenomegaly, and hepatitis. So infectious mononucleosis is a serious condition in which there is also enlargement of the spleen and the liver, and also enlargement of the lymph nodes. and it's caused by Epstein-Barr virus, and there is a fever, sore throat, and exudative pharyngitis. So two common conditions which we talked so far is herpingenia caused by Coxsackie virus, and then we have infectious mononucleosis caused by Epstein-Barr virus. Then other is CMV, cytomegalovirus, CMV. That's the presentation. You can see the throat is all red and congested. Mostly affects immunosuppressed and transplant patients whose immune system is depressed. They are immunocompromised patients, usually who are diabetic, who are taking the chemotherapy, and then who are using long-term antibiotics. Different immunocompromised patients are attacked by the cytomegalovirus, and also patients who have received any type of transplant. It mimics infectious mononucleosis, so it resembles infectious mononucleosis in which there is fever, sore throat, and then we already said there is enlargement of the spleen, liver, and the lymphadenopathy or lymph nodes. Neutrophil antibody test is negative in cytomegalovirus infection. Neutrophil antibody test is negative. So features are more or less resemble infectious mononucleosis, but in cytomegalovirus, the neutrophil antibody test is negative. Some other viral infections are the pharyngoconjunctival fever, which is caused by adenovirus. Sore throat, fever, and conjunctivitis is present. All eyes are red and painful because of the involvement of the conjunctiva. Pain in abdomen mimicking appendicitis. So that's the pharyngoconjunctival fever. It's caused by adenovirus, and there is also involvement of the conjunctiva, and there is pain in the abdomen which mimics the appendicitis. Acute lymphonodular pharyngitis is caused by Coxsackie virus. There is fever, malaise, sore throat, and since as the name shows, lymphonodular, so there are nodules present, white, shallow, solid nodules, that gives the name lymphonodular pharyngitis. Then we have measles and chicken pox. That's the rash which is associated with measles and chicken pox. So we have coplic spots are present, appear 3 to 4 days before the rash, and this is on buccal mucosa, on the mucosa of the cheek. So all these are the different presentation: pharyngoconjunctival fever, lymphonodular pharyngitis, and the measles and the chicken pox. Some fungal type of pharyngitis caused by fungal infections, and this is fungal infections are common in immunosuppressed patients and those patients who are on antibiotics. And the candida infections. Candida is very common cause of fungal pharyngitis. Candida albicans is the normal flora of the body, of the mouth, but whenever the immunity is depressed or patients who are immunocompromised, even the simple infections can become the severe and they start affecting the patient. So candida infection of oropharynx, you can see very characteristic of candidal infection. These white patches are formed. Extension of oral thrush, complaints of pain in throat and dysphagia, and nystatin is the drug of choice which is the antifungal drug. Miscellaneous causes are the chlamydia trachomatis infection, which cause acute pharyngitis, and it is treated by erythromycin and sulfonamides. Then we have toxoplasmosis infection, which is caused by Toxoplasma gondii, and then it's obligate intracellular parasite, and it's very rare. So these are some miscellaneous causes of the pharyngitis, in which we have chlamydia trachomatis infection, and then the toxoplasmosis, but it's rare. So these are the presentations of chlamydia trachomatis and the toxoplasmosis pharyngitis. This was all about section 3. Thank you for watching sqadia.com.